Hi, everyone. We're ready for a live with CCO. We're on episodes number 72. This is our casual get together with CCO to see what's happening in the arena of medical coding and the medical field and all the certifications that we all get. We get questions that come in, and we prioritize those questions into a webinar based on the question type. And one of the questions that we get very often is, you know, after I pass my certification and I get out there in what we call the real world and I start coding, am I going to use my manuals? And if so, or if not, if I'm not going to be using my manuals as much because you need them to test, then what am I going to use? Well, we got some points for you. I'm going to show you how to use an encoder. And I also am going to tell you a funny story. I went to my local chapter's symposium yesterday, and they had a fabulous orthopedist come in to talk about orthopedics a little bit, but also to talk about communicating how providers think and how we in the coding world think and how we work together. And he made a comment that really resonated with us. He said, "Here you come in with this huge book, and it's all dog-eared, and it's bound by metal, and it has sticky notes coming out of the corner, and tabs, and notes and stuff written all over it. And it says 2020, which is funny because, again, when we're airing this, we're in 2022. He said, and the reason it says 2020 is because you haven't had time to put all of your notes and write them, all those wonderful notes into the new manual. And all of us thought, yeah, you're right. That's right. You carry around that big manual with you. Well, truth be told, we do keep our manuals and we do write notes in them, and we still look things up in our manuals. But we also use encoders. There's multiple types of encoders out there, and that's how we do medical coding without a manual. I'm going to walk you through the encoder that we use at CCO, the one that I use when I do any other work, whether it's contract work or I work for another entity. We all kind of pick up side jobs and stuff. It is the encoder, again, that works best for me. However, there's multiple out there, and um, they work predominantly the same. So each one of them has a little attribute that maybe you like more than others. And you've heard us talk about how we like find a code. So I'm going to use it as the example of how we work through medical coding without having a manual, or what we do without manuals. This predominantly is going to be for people that are looking to get into medical coding and are curious, and they know we have to walk around with those big, giant, thick manuals, and also students. This should resonate with you. And oh, looks like we got somebody new that's never joined us before. And again, coding with manuals and coding without your paper manual ultimately is the same thing, just a different format. The manuals are going to be your CPT manual, your HCPCS manual, the ICD-10-CM, and ICD-10-PCS. So there's 4 manuals that you can use with medical coding. CPT in that manual will have procedure codes for outpatient services, and the ICD-10 PCS manual is procedures for inpatient coding. The HCPCS manual is the manual that has all of the supplies and medications and things that will be used for Medicare patients. And then ICD-10 CM is your diagnoses. It has all of the diagnoses that your patient could have. With your certifications, you're going to use these manuals. Now, ICD-10 PCS is unique in that it is only used for inpatient coding. If you're going to get the CIC or the CCS, then that is the code set that you'll be using in that manual. The other three manuals you'll be using for outpatient, but you do have to know the CPT codes if you're going to get an inpatient credential, because surgery centers and stuff will use them. All right. Uh, oh, uh, Tangela says Optum Encoder 360. Excellent one. Well, just let us know what are some of the encoders that you guys use. And I'm curious if you've paid for them out of your own pocket, or if um, do you have an employer that pays for them for you? uh, that does make a difference because they're not cheap. It's a yearly subscription to use an encoder. If you're lucky enough to have an encoder that you can use that's provided at work, and you're almost guaranteed to have one, that's fabulous. But you can't use theirs for outside jobs, right? So if uh, I have find a code that I use for everything, So even though sometimes when I have other jobs that I would do, they would provide an encoder, but I just don't use them because I use the one that I'm familiar with, and I've got notes and stuff in there. All right, so that is the four manuals, and they will be available to you in the encoder, as well as additional things I'm going to kind of show you that you may need, like the previous year manuals would be in your encoder, and the new codes when they drop, that'll be supplied in a list form. The guidelines are all in the encoder. Everything that's in your manual will be in the encoder that you use. Now let's talk about how we search for codes in an encoder. We have an index, we have the tabular, and we have a neoplasm table. We also have a table of drugs and chemicals. I didn't pull that out, but we can show that to you. And I just picked up some diagnoses and procedures, and we're going to look those up and kind of walk through those step by step. And that way I can show you how an encoder works. Again, I use find a code. So the very first one that I thought we would walk through together is epilepsy. And I'm going to bring my encoder over. All right, I'm going to leave it just, I think you can see it. Uh, Notice here that it allows me to look up the different codes and also additional information. A unique thing about the encoders is that if you want more content, or if there's special resources that they offer, you can usually get those on as add-ons. So you'll notice here when I hover over diagnoses, I have the ICD, the 10, so that's going to give me everything that would be in my ICD manual. But it's also going to give me the DRGs. I could look at just HCCs. I have access to ICD 11. I have SNOMED, and I can go back and look at things in ICD 9. Now, I can also, encoders will have ICD 9 next to ICD 10, which is kind of a nice perk as well. For the most part, we don't mess with ICD 9, but there are scenarios where you may be in a position where you need to know those. Here, when I hover over procedures, there you see that I have CPT, HCPCS, I've got the dental codes, I have PCS, I also have I don't know how you say that. It's LOINC, SNOMED again, and then available, I could get APC, ASC, which is Ancillary Surgery Centers, AltMed, and version 3 or volume 3 of ICD-9, which was where all the procedures used to, additional like PCS was housed there. Supplies, HCPCS, drugs and vaccines. If I need information on that, it's at my fingertips. And then I've got a place for notes. It's the same thing as writing in your manual. Next to the codes, you can make a pop up with your codes. Maybe most of the notes that I've taken, I've gotten at conferences. I would take my um, my laptop with me, and then when they talked about a specific code or something interesting, I could type in a note to remember, so I don't have to worry about pieces of paper or writing that in your manual. So again, that works good. There's also some additional CMS forms, UBO forms, HIPAA, and things like that. Other code sets that I've never really played with that much. But that being said, let's just look real quick at a few ancillary things that you could get. Let's see. Sarah says ICD-11, watched your video on that. Uh, will be an adjustment. Sarah, ICD-11 is going to be fabulous. It's not going to be a problem. There's no reason to fear it. And if you ever get a little nervous about it, you just come and send me a note. Melissa says she uses Codified by the AAPC, and Genefa uses 3M encoder. And that is, 3M encoder is probably the biggest, I would say. Yeah, most places have that. So I have a library of content. I have guides, tutorials, and stuff like that. There is newsletters, and I do have coding clinic that I use, but that all pops up with my code, which is an advantage of not having your manuals. I don't have to go in and reference another device, or I don't have to go look at another book or guide. It's all right there at my fingertips. There's tools. There's the best calculator is I use the HCC risk score calculator a lot. There's an E&M calculator. There's even information on home health now that you can get in here. So again, let's go ahead and look up those diagnoses, see all of the options when it goes into looking at the code sets. I picked ICD-10, and then I can look at the new codes for 2023 when they drop. But if I wanted to look at the new codes that came out for 22, that's at my fingertips. And then I can build codes and map codes. It's a lot of fun to use those. I also have the guidelines at my fingertips here if I want to go back and search. And for education, if I have a student that asks me a question and I want to reference a guideline for them specifically, I can open that up, grab it, either take an image of it or tell them literally what page it's on, or I can highlight and grab that and copy and paste it for them. Very handy. That means you could do that if you're at work and you're needing to educate somebody at work, or one of your providers asks a question about the code set. And you say, well, there's a guideline that directs us to do XYZ. And you can reference that. So the Neoplasm table, we'll get to that in a minute. The drugs and chemicals, I chose not to pick anything from there. We might take a day to talk about the drugs and chemicals, uh, just to get a little ease of use and practice, maybe. So we're going to look up epilepsy. Now, if you have your manual with you, we'll do it at the same time with me. Open up your ICD-10 manual and look up epilepsy. In this instant, all I have to do is put in the first few letters, because I still have trouble spelling stuff. It didn't come up with epi, so epilepsy, and there, I didn't even have to spell the whole thing. Then I literally as if you're looking at the index and then you find what page epilepsy's on, and then you're going to run your finger down. I can do it here with the drop down. I could literally type it in. Let's see with let's make it a little different. Why don't we say intractable? Because I'll use my son for an example. He's intractable epilepsy, which just means is a fancy word for saying that the treatment hasn't been successful. They're still working on it. Okay. Now, is it with status epilepticus or without status epilepticus? He had been status epilepticus. He's without status epilepticus now. Now, I can click it here and it will bring me directly to the code, or I could scroll down. And the advantage of this is, look, if I want to know if it's an HCC or have any additional information, it's right there on that page, and it's probably there on yours as well. So I'm going to say without status epilepticus. Then it gives me the code G40919. Now I want to. I would just click on it, but here for this presentation, I'm going to put it in another plane. Now, this would be the equivalent to going to the tabular, G40919. Now that we've got the code in the index, let's go look it up in the tabular to verify it and make sure there's not any tweaking we need to get to the proper code or the highest specificity, or if there's any um, additional information. You might see a guideline that says code first or code in addition. So here we have epilepsy unspecified, which I could have gotten a specific type. He's right frontal lobe and he's in the back here. Uh, so I want to say we're going to code his out. We can actually get to a higher specificity with that. So that we know that what type of epilepsy or where the epilepsy occurs in the brain is unspecified here, but it's intractable without status epilepticus. Now, then I've got everything that you see in the manual, and actually it's all on one page, where in your manual it isn't on one page. You have to go back a couple pages or move your finger and find where some of these excludes and include the includes is, but the excludes 1 and 2. They'll be there, but they may not be right there close. They'll be over at G40, not at G40919. So you have to go back a few pages. Plus, let's say I look at this and they said, oh, no, they actually said convulsions, not epilepsy. Well, that's R56.9. Well, um, I can click on that and it'll instantly open that page for me. So again, it ends up being much faster. Um, but let's say I wanted to find right frontal lobe because that's what he is with unspecified. Now, I can do a couple things. The main thing is I can look here, and this would be the equivalent of you looking at the whole page in the tabular. So I know this says unspecified, and I'm going to go up because with my finger. So it's still unspecified, and it's not other epilepsy, which other is defined by the code set as you've defined it. The provider's defined it, but there's not a code for it at this time. So here is related to external causes, no. And then it's not idiopathic. His isn't. I want it to say localized frontal right here. Localized focal or partial. He's frontal lobe. I thought there was one that said frontal. Let's keep looking. And his is focal, I guess. But look at all of these localized, symptomatic. No. Again, you're just running your finger up. Seizures of localized onset, intractable. Yes, that's what he is. And so related focal partial, idiopathic. It's not idiopathic. Symptomatic. Symptomatic, yes. Epileptic syndrome. Nope, he doesn't have epileptic syndrome. Oh, no, and epileptic syndromes with complex partial seizures, not intractable. Okay. So again, look at all of my options that I have to go there. Now that I've shown you this, let's um, he's focal. So I'm just gonna pick this one. I'm gonna pick that. Now I want to show you another feature. Say I want to go up and get the details with your page, it's all right there. But say I want to go back one code. There it is, G40119, and go back to the code that I looked at, or I can go up one. Very, very helpful. I really like that it works so well. Also, notice here something that you don't get in your manual is this additional information that breaks down all the different types. So if I'm reading the provider's documentation and he just put plano epilepsy with, as the code that he picked. However, he has all of this other documentation that states a higher specificity. Maybe he just doesn't know. So he used epilepsy unspecified when in actuality, because of the documentation I see, he says that he's partial. And again, it stays within a certain area of the brain, usually temporal, frontal, and my son's frontal and occipital. And so again, that allows if they say, "No, he's frontal lobe in the documentation," I can say, "Oh, look, right there." And then if I need to show the provider the documentation, I've got everything at my fingertips. Very easy to do. All right, so let's go and look at the next, stroke. We know a stroke is not just a stroke. Let's go back to the index. Let's clear our um, let's clear the screen. Now, a stroke. Are we going to look up the term stroke? Let's just see what it does. Oh, well, you got to be able to spell it. Stroke. And it says that there's different types. But what is a stroke? It's a cerebral vascular accident. So let's see. If I were to pick stroke, it's cerebral. And it does. It gets me to cerebral infarction. And then it gives me all of this information. Cerebral infarction unspecified. Now let's go. Uh, I don't think we can get it through accident, but let's just see. Accident, cerebral accident, cerebral infarction unspecified. Isn't that cool? Now, if it is, notice a cerebral vascular accident or infarction here, cranial vascular, vascular brain, all of those are the same code to look up. But let's go ahead and look up the specificity that we can get within that. And the index got us to the right place. Now we're looking in the tabular. You guys follow along in your manual. And the advantage of doing this online is that it's so much faster. So I have a stroke, not otherwise specified. But what are the possibilities? One, remember, I got all of this here with notes of, hey, by the way, if they administer TPA, there's information here regarding that. And if there's a stroke scale, they give you the code R29.7. Sorry. My throat is scratchy today. Okay, let's see. Ooh, traumatic intracranial hemorrhage. Now that's different. That is a hemorrhage. That's a bleed. Um, you can still have a stroke that's a bleed, but this is traumatic intracranial hemorrhage, meaning you got hit in the head, right? Not a blood vessel popped. So here is the excludes transient cerebral ischemic related syndromes. And what are the different types of information. We could have other, I already told you what to find other, due to unspecified occlusion or stenosis of the cerebral artery. We can go up due to occlusions. Let's see, uh, stenosis of anterior cerebral artery, middle cerebral, and look at all the possibilities. They really break it down. And this is at my fingertips. I can click on anything, or I can go, oh, wait, is it this code or is it this code, right? What goes, ooh, vertebra artery, wrong one, at my fingertips. Now, another thing that is at my fingertips, I can go up and look and see what the HCC is on it. I can even, and this is just a perk, look, I can go look up the HCC. That was version 2022. I would have picked 24. I didn't see what I did there. Gives me all the HCC information. It even, looky there, more information on that. We don't need to see that now. Okay, let's collapse that. What is some more information about the code or the guidelines about the code? Breaks it down, easy view. This is, I have to tell you, it's brilliant if you're an educator. We do take advantage of that. But what about articles? There are 3 coding clinics. Let's see. We have one asked that for one about CVAs and strokes. Here's the health stroke scale, and notice that code, and acute cerebral infarction with left-sided weakness. Let's see what this one says. So I go to coding clinic and they gave an example. 84-year-old male with chronic gait instability is admitted after a fall. The provider document states that the patient's gait instability is related to the CVA. How is that due to a chronic, how is it going to be coded? And then it tells you you're going to use the code for the stroke or other abnormalities of gait. Mobility is right there. And I I63.9 is an acute stroke. That means you're in the phase of the stroke. Once they leave and they're being followed up, if they have they no longer have the stroke, but they have a residual, then it's I69. And look, you can even get to the it's a stroke with a sequela or late effect, and it's 398 is the gait and disability. And this is other anomalies of the gait and mobility. So interesting, isn't it? Isn't it awesome how I can look all that stuff up at my fingertips? All right. Then let's go see if we want to now look up multiple sclerosis. I purposely picked diagnoses that are going to give us interesting things to look up. So we don't look up multiple, we look up sclerosis. So sclerosis or sclerotic, and we want multiple is how that's divided up. So I can either, here we go, brain. And multiple sclerosis tells me it's G35. I go in, I look there, get rid of that. All of the different verbiage, which is also in your manual. And then symptoms and information about that. I have my guidelines. I have my HCC. I have my articles. Oop, there's one on and peripheral neuropathy. Information about that. Isn't that cool? All right, let's clear that. Let's look again. Parkinson's disease. How would you look up Parkinson's disease? Because Parkinson's is a capital letter, a P, it's named after somebody, you can literally put in Parkinson's disease then. If it wasn't a capital, you probably couldn't look it up that way. And then it says look up Parkinsonism. And there it is, G20, Parkinson's disease. Now, there's information about Parkinson's disease that is a great little tool here. Notice that if they have dementia and Parkinsonism It's a different code. Also, they're going to let you know that there's specific notes about the coding clinic and coding F02.81 associated with dementia and some other, same thing happens with Alzheimer's. There's an F code that's associated to that you need to have available. You you will probably see that in your coding manuals, but these are guidelines also that you would want to be aware of for testing purposes. All right, let's go look at the neoplasm table this time. Now, I can just change this to the neoplasm table, and we're going to look at breast cancer. That was the next thing on the list. When you look at the neoplasm table, so open up the neoplasm table in your manual, and you will go to the body part or organ. Now we're doing breast cancer, so we just would type in breast. And there's different areas of the breast. If we don't know, then it's going to be unspecified. But let's pick axillary tail. That's the bottom part of the that goes down kind of under the armpit too. And then it literally opens up to breast cancer, axillary. If it's the second number here in under primary, and the axillary tail is C50.6. Now, you have the dash because it's going to ask you laterality, right, left, bilateral, etc. But this is my starting point. The neoplasm table is your starting point, and then you're going to jump out to the tabular. I also have, just like in the manual, the secondary cancer in situ, benign, uncertain, and unspecified behavior. Let's just say that it is cancer in situ. Let's click on this one and let's jump out and go look at it. And you can see how the code's built out. It's going to say, is it? And then is it lobular, intraductal? And then we got to see what breast. Let's say that it's intraductal because that's very common. And now we get unspecified breast, right and left. Very quick, very fast, isn't it? All right, let's go look up some more things here. Metastatic lung cancer. Now, again, that would be secondary. So all we have to do is put in lung, pick the area. If it just says lobe, not otherwise or not elsewhere classified, let's pick that. Secondary would be C78.0. I'm not going to jump out to that one. Let's move on. Let's look up an appendectomy. Now, we can look that two ways. We can switch to the CPT. So let's look there. Yes, I want to change indexes. And let's look up appendectomy. Appendix. Ooh, I think that's going to I don't know if it's going to, I think it's not going to give me the right thing. Removal. So it tells me the code range is 44950 through 44970. So let's just pick the first one because I can jump through the codes with the arrows. So here's just a plano appendectomy. It gives me the information and it says, oh, by the way, use 44955 when the appendectomy is performed for a documented medical reason at the time of another major abdominal surgery, which could be gallbladder. That's what pops into my head. Then I can look at the index and see, oh, look, there's my choices. There's one with abscess. I could have gone one at a time if I wasn't sure. And if you're curious about the BAT technique, they got it built in on a lot of the codes. So this is where you would highlight after the semicolon. More information about that. Very cool. But what if it's PCS? What if we're needing to use the PCS code. So let's just go to the different code set because it's looked up differently. Yep, I want to change code sets. And we're now in PCS. PCS works very differently than uh, the index and stuff works differently. So I can try to put in appendectomy. I don't, oh, well, it did. Okay. It's under a release. So we'd look under med surge, we'd look up the body system, and then what's being done. Um, and if we're releasing something from the body, let's see release. Let's look here first. Excision, resection. Are we doing an excision or a resection? Well, let's look at the difference. And if we're doing a resection, they're going to want to know it's the gastrointestinal. It's what are we doing? We're doing a resection. What body part? The appendix. Let me see if it gives me no, that's not what I wanted. It gives me everything that you could resect in the body. So let's say open approach. Let's see what a resection. That's ODTJ0ZZ. And this is the excision. However, you really got to know what the difference between an excision is and not. But let me show you one more tool though. This is really cool. We are going to do search. I want to build a code. Let me go back into codes, close. I want to build a code. I use this a lot. So I'm going to go into PCS. Now, I know I want to go into med surge and I want to take out the appendix. And so I'm in med surge. What body system is the appendix in? It's in the gastrointestinal. And then what am I going to do? Excision and appendix. Appendix, open approach, no device. And it gave me that code for an excision of an appendix. Isn't that cool? You can do that with ICD-10, where it says, let's look up that metastatic lung cancer, malignant neoplasm. Let's not do metastatic. Let's do primary. And then it says ill-defined. No. Let's see how I can just digestive organs. No, I want the lungs, respiratory organs, and I want to do nasal cavity, bronchus and lungs. Then we'll just pick middle lobe bronchus, and then it allows me to just keep building C3-4. And you can do this with CPT as well. Very helpful, I think. Really, really beneficial. All right, so let's get rid of all of those. Let's look real quick. Let's skip the infusion. Let's go look at HCPCS because we haven't touched HCPCS. Now I can look here. I put in there a wheelchair cushion. So I'm going to go look at the index. And actually it still says, let's find HCPCS. Index. Cushion. Is it? Cushion. Wheelchair. And it just gives me the code. I don't have to click anything. E0977. Super simple. Let's see. What was the other thing? Prosthetic eye. I just made that up, so I'm not sure how this is going to work. Prosthesis. Prosthetic additions. I think, oh, there. Prosthesis. Eye. Then it gives me all these. Fitting. No, wait. I right here. L861011 and then V codes. Ocular implants. What's this one? Prosthetic eye plastic custom to prosthetic other type. So let's do that. A plastic eye prosthetic. What are my choices? Resurfacing, enlargement, reduction, scleral cover shell, fabrication and fitting of ocular conformer, and prosthetic eye other type. How cool, right? Very good. Okay, let's just look here for a second. Let me move this out of the way a little farther. The resources to find how more information about Find a Code is at findacode.com. And again, very easy to use. This is how you get by with coding without your manuals. You can still go put your notes in within the encoder. You can highlight and flag codes. You can put codes in a grouping. Say you predominantly work um, critical care, or say you're an orthopedic, and you can clump those procedure codes together, maybe CKD, and you want all the diagnoses related to CKD, uh, the CKD with diabetes and CKD with hypertension and CHF and stuff, and you link all those codes together in your notes so that you could leap out and find them at a moment's notice, because you can never remember which CHF systolic is, or diastolic, or systolic on diastolic, and so on and so forth. Very simple to do, and it's fun. And it is also important to keep in mind that uh, one, your employer may pay for you to have an encoder. Doesn't necessarily mean that it's the best encoder out there for you. You want one that's going to make your life easier. I find that Find a Code is the easiest one for me to use, especially as an educator. However, uh, look at the investment. If you want a discount through CCO, it's up on the screen here. That is a special promo code of CCO3. The great thing about most of these companies is that you can get as little or as much as you want. So you don't have to pay for extended all the options. You don't need coding clinic in there and some other things that might cost you more. Or if there's a specific resource that you want, like a specific dictionary, that can all be included. And there you go. Find a Code has a researcher student essentials annual plan that only costs $100 per year. So you could try it, play with it, see if it works for you, it resonates, and then add onto it as you go, as you start using more things. Um, like I said, it allows you to personalize. You will use encoders. It's just going to happen. So get familiar with them. There's a free version that you can use, but it's not going to give you any more information than you need to by just Googling a code, right? So what's proximal AFib, ICD? You could just type that in and it'll pop up. That's about all you're going to get. However, I encourage you to play with it. So you might want to go to Find a Code and just start using it, and uh, and see how you can play around and get codes real fast. They also have an app, and a lot of them will have apps if that's something that you want to use, or if you're uh, working on projects and you just want to open it up real quick and have it on your phone. I have done that as well. Somebody asks you about a code and you're like, oh, I don't know, and look it up. Yeah, they all have to be better than flipping through big books. We don't get rid of our manuals, and we still order the new manuals every year. Um, I still like to have a manual next to me. I like flipping, it's really, but I have to admit, once I really jumped in and started using the encoder, I haven't cracked a manual for a while. I get them. They're there for me. They have handwritten notes that are specific about things, but Robin's correct. It takes more time to flip through the pages when you can just pop this information. As a student, you need the manuals. You need to learn on the manuals and know how to use the manuals. But if you uh, are production coding, and really once you get out there, you'll find you'll have multiple monitors. So you'll have your, um, I have find a code up on one page, and I have my documentation up on another, and then I'm looking through doing stuff, or I have more than one tab up. It's real easy to use at your fingertips. So, thank you guys for joining us. We have so much fun sharing this information with you. Again, I know we talk about Find a Code a lot because we like it, but it is true that find you know and using an encoder is something you're going to have to know how to do that, and also things like Excel and some other basic stuff that you probably learned through the years. That being said, if there's something specific you would like for us to talk about, to do research on for you, let us know. It's really easy to do that. You can send in the topic request at cco.us/topic hyphen request, and let us um, do presentations that are valuable and helpful in your everyday life, or as you're a student walking through this path. We're on the journey with you, holding your hand if you need us to. We have fun sharing our knowledge, and we want to encourage you and give back as much as possible. If you come across something that's beneficial that you think will help others, feel free to let us know. We'll share it. We'll do some research. Also, know that we have a great forum and our CCO club. You can go in there and share content, ask questions, and our club members always get priority in everything that we do at CCO. Robin said, just an FYI, I don't think CCO has this, but most public libraries offering free courses on using Excel and other common computer programs. Brilliant, Robin. That is excellent. You're right. I was going to say, you can go out at YouTube and, look up how to do certain things in those programs. But if you have a public library that you have access to, Robin's correct. You can go and get some hands-on experience with somebody standing there helping you. It depends what type of a learner you are. If you can just run out to YouTube and do it, that's fine. But if you want to be able to do it in more of a classroom setting, then libraries are a very valuable resource to be able to do that for you. Yeah, they'll run you through all of the Microsoft programs. And she says you can do it all online also from home for the courses. I didn't know that. When I remember them talking about it, uh, when we were living in St. Louis many years ago, the public library did, and they would have you come in, and they had computers there. And so they would have like 5 computers. And if they had 10 people sign up, then 2 people would share a computer, or you would have your own, depending on the slots. And um, so if they have it online, great, right? They probably have a hybrid. Maybe they have both, depending on what the resources are, where you live, how big your library is. Or it might be something you want to suggest that they do that. Robin says, go to your public library website. Very good. Click their e-resources. Yeah. Now, if Robin's a librarian, then, or she just really loves libraries. Libraries are a great resource. Yeah. Thank you guys very much. We'll see you next time. Bye.
Do you need more medical certification and business training? Learn more at www.cco.us.